Welcome back. Now, after 2 months, the Union Health Minister has chaired a meeting of the COVID task force as infections are on the rise across China. The government has advised citizens to wear a mask in crowded places, even as it insisted that there is no reason to panic just yet. The central government, meanwhile, has already urged all states to conduct genome sequencing of positive samples to keep track of emerging variants. Health Minister Mansukh Mandavia has asked officials to strengthen surveillance as well.
18 के ऊपर प्रिकॉशन डोज सबको लगनी चाहिए, लेकिन लगी है सिर्फ 27-28%। तो हम अपील करेंगे कि प्रिकॉशन डोज जिसको नहीं लगी है वो ले लीजिए। ये भारत की पेंडेमिक रिस्पांस का एक पिलर है, पॉलिसी है, वैक्सीन अवेलेबल हैं, तो उसको तरफ जाइए। और पर्टिकुलरली जो हमारे सिटीजन्स, सीनियर सिटीजन्स हैं, वो कोई छूट गए हैं प्रिकॉशन डोज से, तो हमेशा की तरह जैसे हम पहले भी अपील करते थे कि उनका हमें ज़्यादा ख्याल करना है।
To help us put these developments in perspective is joining us a distinguished panel. Firstly, Dr. Rajesh Chawla, Senior Consultant, Pulmonology and Critical Care at New Delhi's Indraprastha Apollo Hospitals, with us. Also with us, Dr. Sanjith Saseedharan, Consultant and Head of Critical Care at Mumbai's Fortis SL Raheja Hospital. And also joining us, Dr. Sandeep Nayar, Senior Director and Head of Department, Chest and Respiratory Diseases at New Delhi's BLK-Max Super Speciality Hospital. Gentlemen, thank you so much for joining us. Mr. Chawla, let me come to you first. As the government itself, as Mr. Mandavia himself, in fact, shared with the members of the press that this variant that is being seen is in fact the BF7 strain of the Omicron variant. The question I then want to ask you is, as a country that has already experienced the Omicron wave, how much of a concern is this for India?
You know, I think this panic which has been created is because of the rise in the number of cases in China recently. And deaths have also been reported because they lifted the ban and suddenly there is a surge of cases. So far it is a Omicron variant, and as you said, but I think the only worry is that because of travel, no travel restrictions and people will travel, and as the number of cases may rise in China and some other part like US, Korea and others have also reported little increase in the number of cases. So at present, I think we should not panic. And this is an indication that pandemic is still not over. And we should continue to have a policy of testing, tracking, treatment and vaccination, because they should and we should all follow the COVID appropriate behavior. Because I think till the whole world of this for a long time, we should not think it lightly, like because in India, most of the places we are not wearing masks. This is another indication that the time is coming, we may have to again go back to mask if you have decided not to put it, because of winter coming in, people are in closed spaces, so this can really create trouble. So as of now, there is no panic, but I think one should be cautious.
Interesting. You're telling us no reason for panic, but one does need to be cautious. Mr. Saseedharan, same question to you. We've already seen the Omicron wave in India. India was able to tolerate that and able to build resistance to that. The question I then want to ask you is, an increasing body of work suggests that even the new variants that may come, while they may be more transmissible, needn't be necessarily more lethal. Your quick take on that.
Yeah, it's very clear if you look at evidence and what happened in the past. In the March 2022, when we had this massive surge of Omicron all across the globe, there were 60 lakh cases. As of today, there are 17 lakh cases all across the globe. Another thing that we should think is, in Jan 2021, when there were 4 lakh cases per day, there was 1 lakh deaths per day. Now, we are in December 2022, there are 4 lakh cases and hardly 1,289 deaths. So irrespective of what the variant is, you must understand that the sublineage is of the Omicron variant. And the Omicron variant is not very virulent as of now. Yes, this does not hold good for immunocompromised patients, those who are having comorbidities and the elderly population, but are largely so because of the excellent amount of hybrid immunity that we have. This is not supposed to be very virulent, and that is what is seen across the world.
Sure. Dr. Nayar, if I can take this up with you, then in terms of the situation that we have currently in the country, we've seen vaccination of a very large segment of the population. We've seen 3 waves of COVID, which has helped build some amount of natural immunity. Does that then give us a clarity about the road ahead in terms of what Dr. Chawla said, that there is no immediate need for panicking or a knee-jerk reaction at that?
Absolutely. We must compliment our vaccination program, the way it has taken off, the way we covered such a large population. It's been a huge success, honestly speaking. Secondly, unfortunately, many of us definitely got infected with the COVID also, and probably there's some herd immunity which has been certain among all us Indians. If you look at China, they were the early lockdown and they were a fixed number. There was never an increase in number, and probably none of them were infected that way. Probably that herd immunity probably wouldn't have been there the way we have it with us. And of course, our vaccination schedule was amazing. Second thing, which Dr. Chawla also said, that nothing to panic. I would also reiterate one more point. Of course, at present, the numbers are not there in India, but there's no travel restriction, which already pointed out by Dr. Chawla. And the way we are open to it, you never know how we start moving from one place to another. So we have to take precautions. The COVID-appropriate behavior should be taken. And yesterday, I think in that meeting also, they emphasized on, again, masking to be taken up. Because the COVID-appropriate behavior plus the vaccination was the only way to look forward. So the second point which Dr. Saseedharan said was that about the number of deaths were higher in the initial wave. There were 2 reasons. One, of course, we were not aware of what this COVID is. It's an absolutely new kid in block. So we were not even knowing how to tackle with it. But by the time we came to know how to tackle them, it was more of the treatment of conservative rather than getting panicky. We knew how to tackle these problems. So combination of all these things, I think we should be able to take care of the problem, but at the same time, be cautious.
Sure. Dr. Chawla, if I may come back to you, one concern that, in fact, not a concern, rather, this was something that the minister acknowledged as a part of that press briefing, is that the current infrastructure, the health infrastructure that we have, given the experience of the last 24 odd months, it is competent to deal with any challenges that may come up. Your quick take on whether the state of readiness is such that any new variant that may perhaps come to light will be addressed sufficiently and competently by the healthcare infrastructure?
Absolutely. There is a lot of difference between the first and second wave and now, because we've all faced it. We are all prepared. Most of the doctors, the hospitals, everybody knows how to treat that, how to treat respiratory failure in these patients. And over and above, most of the population is vaccinated. Although they have not taken the booster shot, only, as I heard, only 30% around people have taken the booster shot, but they should take now above 18 years. But otherwise, there is a much more difference than it was earlier. So we are well prepared and we are well immunized as well.
In fact, you were alluding to a point that I was trying to raise once again with Dr. Saseedharan. Dr. Saseedharan, if I may come to you on the issue of booster shots, the latest concerns that we have seen that the health minister as well is deliberating on the subject. Does it require us to perhaps revisit the booster policy for perhaps a wider spread of the booster shots within the general population?
What we should understand is that the booster is required, period. Booster has to be given to a very large population of people. We must understand that the effect of the second booster is 86% against a severe disease forming. That is the reason that the booster, the third booster, has to be given. We are presently only at approximately 1/4 of our population that has been boosted. 1/4 to 1/3 of our population has been boosted. We should reach somewhere near 50 to 60% of our population. And then the combination of the booster related immunity and the natural infection immunity will create a sort of a hybrid immunity, which is much more stronger than just a herd immunity or just a vaccine-related immunity. And that is why, to prevent another surge, a wave, or any other eventuality, the answer is to actually have a wider coverage with respect to vaccination and boosters.
Interesting. Dr. Nayar, let me also come to you now. One of the concerns that has emerged, at least as far as the government is concerned, is the ongoing festive season. It will continue on to Christmas, New Year's, and then subsequently the big wedding season that we have concluding in the month of March. Can you share with us some insight on perhaps what are some of these safety precautions that can be exercised at an individual level as people go about the next quarter or so?
So, like it has already been said, and I would like to reiterate about the COVID-appropriate behavior. I'm keep social distancing, hand hygiene, and masking. It is going to come back. And of course, already been said, my friend, by the vaccination again is very important. See, all those pandemic which has occurred in the past, the epidemic, our pandemic, whether it was smallpox or polio, is a vaccination which really helped us to, defeat these enemies. So again, if we step up the booster or a precautionary dose, what we call it, it is just 27 to 30%. If we boost it up, then definitely there will be less chance of getting infected. And as far as the mass gathering or the festive season is concerned, again, my request to most of the people who are taking part in it, of course, it's a high time we have taken part in the festival, but please take appropriate behavior, have precautionary dose so that you don't get infected. In fact, even if you get infected, you will not have a very severe infection. Keep an appropriate distance, masking should be there, hand hygiene should be there. And if anyone who is not feeling well because he might be getting infected, please talk to the physician, please see your physician so that you're not spreading it further. So we need to really pull up our socks because this festive season, we have to take full precautions.
Right, Dr. Nayar, thank you so much for sharing your inputs. And I'd like to thank all of our panelists, Dr. Chawla, Dr. Saseedharan, as well as Dr. Nayar, for giving us perspective and for helping us decode the situation as we read about it and as we learn more about it, about the COVID crisis. But that's all the time that we have for. It's a wrap on this edition of Business 360. Thanks so much for watching. Stay tuned to CNBC TV18. The news and updates will continue on the other side.